Hello everybody, this is Khattab. I am a junior doctor studying for the Canadian exam, and I made this table for the colorectal cancer screening that I hope will make your life easier in studying this topic. This is according to the 2016 Canadian Task Force on Preventive Healthcare Recommendations, and it's one of the things that are considered high yield topics for the Canadian MCCQE Step 1 exam. Okay, so this table we have in the x-axis when to start screening, and how frequent. And then these are the different types of patients. We'll go through them one by one, okay? So we'll start with the average risk screening, like everyone who is normal and healthy. You start screening for colorectal cancer at the age of 60 to 74 years old. And if you choose fecal occult blood test, then you do it every 2 years. If you choose flexible sigmoidoscopy, then it is 10 years, okay? So we start at 60, we do it every 10 years. So that is the normal or the average risk screening. Now, if you do colonoscopy and you find polyps, then it depends on the polyps. If there are only 1 to 2 polyps, less than 1 centimeter, then you go by half. So instead of doing screening every 10 years, you do it every 5 years, okay? Because that puts the patient on a risk, higher risk than the average patient. If you find more than 2 polyps, then that is even higher risk, and so you do it every 3 years, okay? So average risk, 10 years. Someone with a polyp found in a colonoscopy every 5 years. And another one who has more than 2 polyps, then you do it 3 years, every 3 years, okay? Now, the next two groups are medical history and family history. So starting with medical history, if someone is known to have FAB or AABC or HNPCC, then you start screening earlier and you do it more frequent, okay? So for the FAB, you do it every 10 years, AABC every 15 years. You start at 15 years old, and then HNPCC, you start at 20 years old, okay? For the first two, you do it every year, so annually, and for the third one, you do it every 2 years. Clear? Okay. The last one is the family history. So if the patient is having a family history of a relative who is having either colorectal cancer or adenomatous polyp. Now this will depend on the age of the relative, like the relative who has the history. So if the relative is less than 60 years old, we will start at 40. We'll start, instead of starting at 60, we'll start earlier because of the family history. We'll start at 40 years old because of that the relative is young, less than 60 years. If the relative is more than 60 years, so we'll start at 50, okay? Now you can notice that if the relative is more than 60, you start 10 years earlier than the average. صح? You start 10 years earlier. So you can follow these numbers, or you can go 10 years earlier, not older, earlier than the age of the relative, like the affected relative. Okay, I hope that is clear. And then you do it, like the frequency is 10 years. So every 10 years, the same as the average risk patient. So this is the table. Thank you.